This is the first time that I've experienced that the 5 acute hospitals have come together with the decision that they could definitely improve quality by merging their resources, that's both financial resources and intellectual resources, and also thinking about the experience of the patient in terms of who they have to see, how far they have to travel, and whether the system is designed around their needs.
There's enormous opportunities to work together, and the great thing about the number of stakeholders we've got here, 13 different groups from hospitals through GPs, community care, primary care trusts, we can all get to know each other and we can actually start doing something, set a ball rolling that we can't stop, to change the pathway for patients and improve and guarantee improved quality for the future.
Our collective objective is to get the patient in the right place at the right time. And if we actually understand that pathway, we can then work out not what's happened historically or just piecemeal grown up, but actually where is the most appropriate place for that patient to be seen and treated.
I think the most important thing that we need to achieve is to get people to think, as they say, in the round and out of the box. Think about the service for 1.6 million people rather than their own individual service units, hospitals, and to make sure that in doing that we look after the patients.
I think the most important thing we need to achieve is some consensus about what the South East Midlands area is going to look like for the future, and I think we all know we're under terrific pressure, both in terms of an increasing population at the same time as we've got decreasing funds coming into the service, and it's a really big challenge for us to be able to essentially square that circle.
I think what we need to achieve is a shared vision and carrying everyone along. So early on in this process, I think there needs to be cascading of information to the people who are going to drive the change, which is the workforce.
We do need to do some work as 5 hospitals working together in the broader health economy, and that will be able to drive up the standard of clinical outcome.
This is an excellent environment where lots of professionals have come together, and also patient representatives have had a chance to put forward the views of the patients. And I think together we need to reach a consensus as to the need to change in order to strive for excellence in terms of patient care.
I hope that we've got a real consensus about our ability to improve and an ambition locally to aim for the very best services that we can develop.
We've, I think, come up with a consensus that people want to celebrate what's good, but also want to actually develop good, sustainable services. So we're well on the way to developing that case for change.